This is Diana Mahoney with the Global Medical News Network, reporting from the European Congress of Rheumatology in Copenhagen, Denmark. I'm speaking with Dr. Tuulikki Sokka from Finland, who presented the results of a global study showing that during this millennium, approximately one-third of patients with new rheumatoid arthritis who are employed at the time of diagnosis subsequently become work disabled because of their disease. Dr. Sokka, can you describe the study population?
Yeah, the study population is from several countries. We started in 2005 and we wanted to invite regular rheumatologists from hospitals, from universities, from private practices, and we invited them to review 100 consecutive patients with rheumatoid arthritis. And we have a certain structure for this. These doctors review medical history of these patients and all disease-modifying drugs, and then every patient completes a patient self-report questionnaire.
You observed a difference in the rates of work disability among patients from richer and poorer countries. Can you explain that a little bit?
About 1/3 of the patients from both of these country groups, third of the patients told us that they are work disabled about 5 years after the onset of the disease in the group who were diagnosed during this millennium. So there were no differences in the rate, but when we look at how the patients are doing who are working in rich countries and poor countries, we see clearly that in poor countries people have a lot more disabilities and disease activity working compared to rich countries among people who are going working also.
Mm-hmm. And how can you explain that? It's just,
I think that there is of course there is some role how we treat patients with rheumatoid arthritis, but I think that the most part is in the society level and the structure of the clinics, medical care. So most of that is also beyond rheumatology and things we possibly cannot influence as rheumatologists or even as patients.
Now you had mentioned that the results were somewhat disappointing, given this is the era of biologics. What does the study tell us?
So I mean, in big conferences and literature and everywhere, we think that we are doing so well with our patients during this time with all advanced strategies to treat early and to use biologic agents and other effective medications. But when we go to the real clinics and collect data from all these several clinics in several countries, we see that the work disability rates are not actually that much different from what they were 20 years ago. So there is still a lot work to do, and the direction we want to go is improvements in these aspects.
This is Diana Mahoney with the Global Medical News Network.